that your heart may not be well and the 7 symptoms of heart problems. Is your heart doing well, or does it have some problem? Today, we're going to talk about the 7 signs that appear in your body that may indicate your heart is not 100%. Cardiovascular diseases are the #1 cause of death and worldwide. Heart disease kills about 400,000 per year, so pay attention. This video is divided into 3 parts. The first part is about the 7 signs, those you can see that something is wrong, what you should pay attention to when looking for heart problems. The second part will talk about the 7 classic symptoms, what you feel when your heart is not doing well. Are you or a family member feeling this? And at the end, we'll give you valuable tips to prevent a heart problem in the future. It's going to be a very complete video, so stay until the end because there's a lot you've probably never heard before. But first, go ahead and like the video, because the more people like it, the more YouTube distributes it to people who don't have access to doctors or hospitals. Also, share the video with your friends and family. Many lives can be saved with your help. Tell us in the comments, do you have a heart problem or think you have one? Write it down below. Part 1, the 7 signs you can see. Let's go. What are the 7 signs you should be aware of that may be showing you have some heart problem? 7th sign, Frank's sign. From today on, you'll start looking at people's ears more carefully. Why? Because there's a little sign on the ear that can indicate the person has some blockage in the heart arteries, in the coronary arteries or carotid arteries. Is this serious? True. Back in the 1970s, Dr. Sanders Frank noticed that many of his patients who had angina, chest pain, had a diagonal crease in their ear, and he described this sign as Frank's sign. What's the connection between heart and ear? One theory is that the same factors that damage the intima of arteries can also cause this crease in the ear. Does everyone who has this sign have blockages? No. Among 100 people who have this diagonal crease in the ear, 30 have nothing, it's just an age mark, but 70 do. And the younger the person, the more likely it is to be a sign of coronary or carotid obstruction. So if a person is 40 years old and has Frank's sign, you need to be more attentive than an 80-year-old person, which is probably just because of age. The sensitivity of this sign is low. That is, out of 100 people who have heart obstructions, only 40 will have this sign. So you can't celebrate if your ear is smooth. 6th sign, hair loss on the legs. Hair loss, first on the shins and then on the thighs, can be a sign that you have peripheral arterial disease, that is, blockage in the arteries of your legs. And since atherosclerosis is not a localized disease but diffuse, if you have an obstruction in the arteries of your legs, you may have blockages in other arteries in the body, including the coronary arteries that irrigate your heart. Most people who have peripheral arterial disease only realize something is wrong when atherosclerosis is advanced. Why do they lose hair? Because hair follicles need nutrients for hair to grow, so they need good circulation. If the arteries are clogged by the accumulation of fat plaques, adequate blood and oxygen won't reach them. In addition to losing hair on the legs, the person may have smoother and shinier skin, cold skin, and decreased nail growth. But it's important to emphasize that hair loss on the legs can happen for other reasons, not just peripheral arterial disease. There's genetics, and you can also lose hair from rubbing against pans.
5th sign, Xanthelasma. You may have looked at someone's eyes and noticed a yellow plaque on the eyelid. This is called xanthelasma. It doesn't hurt. It's usually just an aesthetic problem that grows slowly. Xanthelasmas are the most common type of xanthoma, which are cholesterol deposits in the skin. It's more common in middle-aged women and is located mainly in the inner corner of the eye, most often on the upper eyelid. About 50% of patients who develop xanthelasma have dyslipidemia, either high cholesterol or high triglycerides. And look how interesting, only 1% of people with high cholesterol have xanthelasmas. But researchers have found that having xanthelasmas increases the risk of having heart disease, heart attack, and stroke. Therefore, if you have xanthelasma, it's important to get a blood test and measure cholesterol and triglycerides to ensure they're not high. 4th sign, Arcus Senilis or senile halo. As the name suggests, it has to do with age and is more common in older patients. It's caused by cholesterol deposits on the edge of the cornea and has this white or gray appearance, which is visible above and below the outer part of the cornea. In some people, this halo can take over the iris, the colored part of the eye. The person may notice that they previously had a dark eye and now it's getting lighter. Arcus Senilis doesn't affect vision and doesn't need treatment. But there's a catch. If this senile halo occurs in younger people, before age 45, it may be signaling that the person has severe dyslipidemia, that is, very high cholesterol or triglycerides. And in this case, it's associated with an increased risk of heart disease. If you're elderly and have Arcus Senilis, it's normal. About 60% of people over 60 have this, and after 80, it's almost 100%. So don't and look in the mirror and find Arcus Senilis. Third sign, cyanosis. Cyanosis is that bluish or purplish coloration on the skin. Could it be that it's very cold and it's purple? It could, but it may also be saying you have a heart or lung problem. If an area of your skin is cyanotic, bluish or purplish, when you're warm, this could be a sign that this part of your body isn't receiving oxygenated blood, which is red, sufficiently. An artery may be blocked. Now, if the person is complaining of shortness of breath, it could be a lung problem, pneumonia, emphysema, pulmonary embolism, or heart failure when the heart can't pump enough oxygenated blood. Of course, other cardiac causes also fit here, such as congenital defects like tetralogy of Fallot, which causes cyanosis. Second sign, ulcers. Those wounds that don't heal on the legs or feet may be indicating poor circulation. It could be due to arterial insufficiency, due to some obstruction in the artery that irrigates that area. Normally, the person won't be able to walk much or fast because the legs get more tired and painful, or even have cramps. Most of the time, these ulcers are painful. But if you have nerve involvement, like diabetic neuropathy, you may not feel pain. Arterial ulcers usually appear on the outer part of the leg and on the heels, on the toes, and generally don't bleed. The other ulcers are venous, which are the most common and have to do with varicose veins or venous thrombosis. Unlike the arterial ones, they affect the inner part of the leg and usually bleed. First sign, swelling in the legs, ankles, and feet. This swelling, or edema, in the legs and ankles can be caused by a weak or dilated heart, which can cause fluid to accumulate in the body. You may feel that your shoes no longer fit. Sneakers feel tighter. The ankle becomes soft, like bread that's baking. When you press it, it makes that dimple, what we call pitting edema. You're more likely to notice this swelling in your legs and ankles at the end of the day because gravity increases pressure on the veins in your legs. And if you lie down and elevate your legs, it also reduces swelling. Part 2. The 7 symptoms you feel. And what are the 7 symptoms you're feeling that may indicate some problem in your heart? First symptom, shortness of breath or dyspnea. The first symptom you should be aware of is shortness of breath or dyspnea, especially when you exert yourself. It's fatigue disproportionate to the effort. You become more breathless with everything you do. It could be a heart problem.
Second symptom, persistent cough. Persistent cough with white or pink phlegm, meaning there's fluid in your lungs, in your alveoli. It's important not to ignore this cough. See a doctor. Third symptom, shortness of breath when lying down. Shortness of breath when you lie down, the person starts putting more pillows to see if they sleep better, and over time can't stay lying down, has to sleep in a chair. You can also wake up suffocated during the night, what we call paroxysmal nocturnal dyspnea. This speaks strongly in favor of heart problems. Fourth symptom, generalized weakness. Feeling tired all the time and difficulty in daily activities such as shopping, climbing stairs, carrying groceries, or walking. This is because the heart can't pump enough blood to meet the needs of the body's muscles and tissues. Fifth symptom, nocturia. When you have to wake up many times at night to urinate, this is called nocturia. It has several causes, but if the heart isn't pumping properly, at night this excess fluid needs to be eliminated. Sixth symptom, intermittent claudication. When you walk a few meters and feel pain in the calf muscle. It's not pain all the time, it's when you exert yourself. When you stop, it improves. This symptom means blood isn't reaching there as it should. When you stop, it improves. When you walk, it hurts again. Seventh symptom, chest pain. If you're having chest pain, the first thing you have to think is that it could be a heart problem. You can't think it's muscular, gas, or something simpler. Could it be? It could, but you always have to rule out the most serious thing. Cardiac pain is a pain or discomfort in the chest that lasts more than a few minutes. It can come and go. It can be like pressure, weight, tightness, or burning. It can radiate to the left arm, to the neck, to the back, to the jaw, to the stomach, to both elbows, and may or may not have sweating, paleness, nausea, and associated dizziness. If you have these symptoms, you need to see a doctor as soon as possible. Part 3. How to prevent. And now, how to prevent, how to avoid having a heart problem. 1. Do physical exercises. Get out of the chair. Don't stay still. Physical activity is extremely important for your circulation, for your heart, for your mental well-being. Low-impact exercises such as walking, cycling, swimming can also improve flow caused by chronic obstructions in veins and arteries. If you smoke, stop smoking. Smoking is one of the worst things you can do for your health. Smoking causes impotence, inflames all your arteries, and forms fat plaques, increasing the chance of heart attack, stroke, and dementia. 3. If you're overweight or obese, lose weight. Excess weight increases your blood pressure, worsens blood sugar, inflames, overloads the heart, kidneys, joints, and venous system, increasing the risk of thrombosis, in addition to increasing fat in the liver. 4. Eat healthy foods. Lots of fruits and vegetables, fiber, whole grains, olive oil, and little red meat and processed foods. 5. If you have a family history, especially father, mother, or siblings who have heart problems, heart attack, stroke, stent, had heart surgery, you should be more attentive than other people. If many people in your family suffer from heart problems, more in-depth examinations are needed. 6. Take care of your cholesterol and triglycerides. Eat more oats, cut trans fats and saturated fats, lose weight, eat more fiber, exercise. And even if you do everything right and you can't reduce it, don't be upset if your doctor prescribed medication. 80% of cholesterol is manufactured by the liver. Even doing everything right, sometimes it's not enough. 8. Keep your glucose under control. If you're diabetic or pre-diabetic, controlling your glucose levels well reduces complications. Glycated hemoglobin must be below 7. Closing. And of course, if you think you have a heart problem, if you saw several signs and have some of those symptoms we just talked about, see a doctor, explain to them, and follow their guidance. Did you like the video? Remember to share so more people have this knowledge. Subscribe to the channel for more content about heart health. Until the next video, thank you.